In this video, we will discuss the Ocular Trauma Score or OTS, which is a simple and validated scoring system that helps predict visual prognosis after ocular trauma based on the initial examination findings. The challenge, however, is remembering all the variables and their corresponding scores. So, in this video, I will show you a simple mnemonic to remember the OTS variables along with visual memory tricks that I personally use to recall the score deductions quickly and effortlessly. By the end of this video, you will be able to calculate the ocular trauma score and remember the important numbers without having to memorize the entire table. Let's get started. Before we learn the scores, let's first remember the 6 variables used in the ocular trauma score. To make this easy, I use the mnemonic: a ruptured eye performs retinally poor. A stands for the initial raw score based on the patient's initial visual acuity. Ruptured reminds us of globe rupture. E stands for endophthalmitis. Performs stands for perforating injury. Retinally reminds us of retinal detachment. And finally, P stands for pupil for relative afferent pupillary defect or RAPD. Now, let's look at the actual raw points used to calculate the ocular trauma score. The first step is to assign a score based on the patient's initial visual acuity. No perception of light receives 60 points. Perception of light or hand movements 70 points. Visual acuity between 1 by 200 to 19 by 200 80 points. 20 by 200 to 20 by 50 90 points. And visual acuity of 20 by 40 or better receives the maximum score of 100 points. Next come the negative prognostic factors. Globe rupture reduces the score by 23 points. Endophthalmitis reduces it by 17 points. Perforating injury reduces it by 14 points. Retinal detachment reduces it by 11 points. And the presence of a relative afferent pupillary defect or RAPD reduces it by 10 points. Rather than memorizing numbers, let's convert them into visual stories. Here are some simple mnemonics that can help you recall the scores within seconds. Let's start with the initial raw score, which is based entirely on the patient's presenting visual acuity. Fortunately, this is probably the easiest part of the ocular trauma score to remember. The visual acuity categories progress from worst vision to best vision. The corresponding scores are 60, 70, 80, 90, and 100. Notice the simple pattern. As vision improves, the score increases by 10. Next is globe rupture. Here I start with the number 23 because globe rupture carries a minus 23 score in OTS. Next, I visually separate the 2 and 3. Now, I connect the number with the word rupture. The number 2 resembles the letter R and the number 3 starts resembling the ending sound of the word. And finally, the 3 transforms into an E, completing the word rupture. So whenever I think of globe rupture, I immediately visualize rupture, which helps me remember the score of minus 23. Next is endophthalmitis, which carries a minus 17 score in OTS. So I start with number 17. Here again, I separate the number visually so it becomes easier to convert into a word association rather than memorizing a plain number. Now, the 1 and 7 transform into the word infection. And since endophthalmitis is essentially a severe intraocular infection, the visual instantly helps me remember infection equals endophthalmitis and the score is minus 17. Next is perforating injury, which carries a minus 14 score in the ocular trauma score. Here again, I start with the number 14. Here I start converting the number into a visual image. The circle represents the eyeball, while the 1 and 4 are positioned near the globe. Now, the numbers begin to look like an object passing through the eye. This creates the idea of a perforating injury, meaning both entry and exit wounds are present. So, whenever I visualize this image, I immediately connect it with perforating injury and remember the score of minus 14. Next is retinal detachment, which carries a minus 11 score in OTS. Here I start with 11. The two number ones are transformed into two curved lines. These represent the retinal layers inside the eye. Now the layers begin separating from each other. This visually represents retinal detachment, where the neurosensory retina separates from the underlying retinal pigment epithelium. So whenever I see these separating layers, I immediately remember retinal detachment and its score of minus 11. Finally, relative afferent pupillary defect carries a minus 10 score in the ocular trauma score. Hence, we start with the number 10. Here, the number 1 forms part of the outer eye, while the 0 becomes the pupil in the center. So together, the numbers transform into an eye. Since RAPD is detected by examining the pupil reactions, this visual eye mnemonic helps me instantly associate RAPD with the score of minus 10. And that completes all the major OTS variables and their visual memory tricks. Once we have identified all the variables present, the next step is very simple. Calculate the row score sum by adding the initial visual acuity score and then subtracting the points corresponding to any negative prognostic factors present. For example, if a patient presents with visual acuity of hand movements, the initial row score is 70. If the same patient also has globe rupture and retinal detachment, we subtract 23 and 11 respectively. So the final row score sum would be 70 minus 23 minus 11, giving a score of 36. This row score sum is then used to determine final ocular trauma score category. After calculating the row score sum, we can assign the patient to an OTS category from 1 to 5. Category 1 represents the most severe injuries and therefore carries the poorest visual prognosis. As we move from category 1 to category 5, the chances of achieving good visual acuity progressively improve. For example, patients in OTS category 1 have a very high probability of remaining with no perception of light, whereas patients in category 5 have more than a 90% chance of achieving visual acuity of 20 by 40 or better. Therefore, a higher OTS score generally indicates a better expected visual outcome. The Ocular Trauma Score is a valuable tool for prognostication, patient counseling, and discussing expected visual recovery after ocular trauma. I hope these mnemonics and visual memory tricks make the ocular trauma score much easier to remember. Thank you for watching.